Karli at KHI. Thanks everyone who's in the process of joining here. We'll get started in just a minute, but wanted to make sure everyone knows that we are, our live stream is now up and running. Okay, hi everyone. This is Karli Houchin with the Kansas Health Institute. I show 12 o'clock, so I'm going to get us started. We'll provide an overview of our agenda and some of the materials you should have received ahead of today's meeting in just a moment. But first, want to hand it over to, I think, Jenna from the Revisor's Office for a quick statement on open meetings. Jenna, are you able to unmute? Looks like Jenna might be, oh, there we go. Can we hear you now, Jenna?
Yes. Oh, sorry. I went to give my dog a treat so that he would not bother us during the meeting.
Okay. Perfect. We're ready whenever you are for the statement on open meetings.
Sorry about that. Due to health and safety concerns, members of the public are not in attendance at this meeting of the Special Committee on Mental Health Modernization and Reform Working Group on System Capacity and Transformation. But full access to this meeting is being conducted by medium of interactive communication, allowing members of the public without cost to listen to the meeting through use of live stream audio broadcasting on the internet and teleconference as available. This video can be accessed on the YouTube webpage by searching for the Kansas Health Institute or KHI Live channel. The agenda and all documents for this meeting have been provided by the Kansas Health Institute. Additionally, a link to these documents has been provided in the comments section of the YouTube video previously referenced. Each member of the working group and staff shall state their name and title each time the individual begins speaking or voting so that the individual can be readily identified by remote listeners. Participants are required to ensure that microphones, phones, or other electronic devices are muted when the participants are not speaking, so the ability of remote listeners or observers to hear the proceedings is not unnecessarily impeded. Public comment will not be allowed at this meeting. During the meeting, the committee will not recess to a closed or executive meeting pursuant to KSA 754319 and amendments thereto. And lastly, each motion, if any, will be clearly stated before the working group votes, and the chairperson will announce the results of the final vote.
Okay, thank you so much. So this is Karli Houchin again with KHI. So thank you everyone for joining the call today. As a reminder, this group is a working group of the Special Committee on Modernization and Reform of the Mental Health System in our state. And specifically, this group is working to put together recommendations for a strategic plan for the purposes of modernizing the behavioral health system. As a reminder, our meeting today is on the topic of interactions with the legal system and law enforcement. So that is the topic that we will be addressing over the course of our agenda, and that is our agenda that you should see on the screen now. So in just a moment, we'll do some brief introductions so everyone knows who's on the line. We're joined by a handful of supplemental experts today on the topic of legal system and law enforcement. Then we will get into reviewing some of the existing recommendations that have been developed by former groups on this topic. And then we will spend some time scoring those recommendations using the recommendation rubric that we've used over the course of our work. Then by around 12:55, we will move into the development of some new recommendations. We'll have a list of barriers that this group has previously brainstormed related to this topic, and we will discuss any new recommendations that the group should consider. Then we'll have a few administrative items to cover and we will wrap by 1:30. So just in terms of key materials to support you in participating in today's meeting, you should have received from me via email, and again, it's on the KHI website, as Jenna mentioned. The kind of one of the key documents to have open today will be the one titled WG3 Crosswalk Agency. That's where the crosswalk document is of all of the existing recommendations from past groups. So I would recommend to have that document open and ready to reference over the course of our discussion. And as a reminder, we'll be on topic 8, which is interactions with the legal system and law enforcement. I think with that, we're ready to jump into some introductions here. So what I want to first do is have the working group members, the regular working group members who are on the phone. We'll just run through you all to make sure that everyone is able to have their audio working and so that everyone knows who is on the line. So first up there, I see Kyle.
Kyle Kessler with the Association of Community Mental Health Centers.
Great. And after that, I see Denise.
Denise Zisman with Community Care Network of Kansas.
Then Andrea.
Andrea Clark with the Behavioral Health Services Commission at KDADS.
And I see Representative Shu.
Representative Reese Shu, House District 25 in Northeast Knox County.
Spence.
Spence Cohen, the Court Services Specialist with the Office of Judicial.
And Representative Landwehr.
Representative Landwehr, State Rep 105, Wichita.
Great, thank you. Any regular working group members that I missed going through that roster there?
Karli, this is Dr. Sandra Berg with United Healthcare.
Great, glad you're able to join today, Sandra.
Thank you.
Okay, with that then, would like to ask the supplemental experts who've joined us to contribute to weigh in on this topic to introduce themselves. As a reminder, they'll have a bit of time here in a moment to tell us a little bit about some of their background and experiences that they bring to this work, as well as any comments that they have as far as recommendations towards the goal of the group on modernizing the behavioral health workforce. But then, of course, would encourage all of you to participate over the course of our meetings. Please feel free to weigh in as you are interested to do so. But with that, I think the first person I would like to have introduce himself is Chris.
Thank you, Karli. Chris Schneeweiss with Johnson County Government. I am a senior management analyst, and I am also Johnson County Government's HIPAA and Healthcare Compliance Officer. And for the better part of 10 years, I've been kind of the lead that's been taking charge as project manager over linking our diverse data sets within Johnson County Government, from our courts to our behavioral health, public health, ambulance service, being able to link those data sets together to better provide a more holistic view of the individuals that we serve. So when you have multiple case managers, probation officers, clinicians working with the same individual or the same household, that they are able to identify that, link what services that they're receiving, and then better be able to communicate. So that way we don't have individuals within Johnson County running in multiple different directions, trying to meet multiple different goals because case managers or the individuals working with them aren't familiar with what's really going on. We do that, and we are completely in compliance with HIPAA and every other state and federal statute. And like I said, it's something that we've tried to do, and we are now moving to the phase of actually doing this, hosting this for Douglas County, Kansas, the unified government of Wyandotte County, as well as the city of Kansas City, Missouri.
Great, thank you. Next, I see Sandra Dixon.
Good afternoon, everybody. My name is Sandra Dixon. I'm Chief Clinical Officer at DECA. We are a statewide nonprofit engaged in child welfare services, traffic safety prevention. And my particular area at DECA is I oversee our 5 addiction treatment programs in the state. We have outpatient locations in Pittsburgh, Pratt, and Lawrence. And then we have 2 large facilities, one in Lawrence that serves women specializing in pregnant women and dependent children with a licensed childcare. And then in Wichita, we have combined our 2 locations, our women's program and our men's program, into one large building on the east side of town. And both of the residential programs offer a full continuum from non-medical detox through residential and outpatient. I also sit on the Governor's Behavioral Health Services Planning Council and have for, I think I'm in my 8th year. And I've been appointed to the Supreme Court Task Force on Permanency Planning. So our range of work as an organization in the state touches a lot of the areas that this group is working on, specifically related to the legal system. We are an SB 123 treatment provider. We work very closely with Stepping Up initiatives. Good to see Chris on the phone. We are part of the MyRC rollout here in Douglas County. We're engaged in drug courts, other specialty courts, have staff embedded in county jail. So we're really pleased to be part of this conversation to bring experience and gaps that we have identified as a freestanding substance use disorder treatment program, and the opportunities that have come at the community level to engage in some new and innovative service delivery.
Great, thank you. And next I have Sarah.
Hi, I'm Sarah Hoskinson. I'm Deputy Special Counsel to Chief Justice Lukert. I have worked with the judicial system for about 7 years now on a wide variety of different projects. I do a lot of legislative work now. In my past life, I've worked in the legal aid realm in a holistic legal aid office where we had clients with significant mental health issues, and we worked side by side with social workers to try and help them remain housed and to secure benefits so that they could take care of their daily needs. So I have some experience from that angle, but also a significant amount of experience from the court system. And Karli invited us to weigh in on any recommendations we'd like you all to consider as well. And one that I think dovetails well with the item you have on your agenda today is about our drug courts, as were previously mentioned, and expanding post-charge sobriety treatment for individuals who are in drug courts would be a great help. So I'm happy to weigh in on any issues we can help out with in regard to the court system. Thank you.
Great, thank you. And then I think lastly, Chief Scheibler.
Yes, my name is Don Scheibler, Chief of Police for the Hayes Police Department. I'm also a representative for the Kansas Association of Chiefs of Police, appointed by the Attorney General's office to assist you folks and join you in how we can improve this system. 30 plus years of law enforcement, almost all that in the rural area. I've seen how mental health has gone from when I started, and I won't take a lot of your time here, started in law enforcement. The city of Hayes had a downtown inpatient mental health facility, and now trying to get someone face to face with a person, a client in crisis is truly a challenge. So I'm also a founding member of the CIT Council here in Ellis County. We're very proud of that, but I'm here to assist you folks any way I can. So thank you. I will say that my mother's in the hospital, and so I jumped out real quick to be here. If I disappear, it's not because I don't concerned about it. I just want to jump on here. Thank you.
Great. Chief Scheibler, we really appreciate you taking the time to be on the call. Working group members, any initial questions for the kind of extra experts joining us today before we jump into recommendation-specific discussions? Okay, not hearing any questions at this point. Let me go ahead and put that crosswalk document I referenced earlier. I'm going to put that on the screen really quickly. As similar to our last meeting, kind of our first order of business is kind of, are there any recommendations on this list we don't need to spend time discussing today, either because they've been addressed elsewhere or they are not pertinent to the goal of modernizing the behavioral health system. So the suggestion that I received via email ahead of our meeting was that this Tier 2 recommendation code of care of children under the Child Welfare System Task Force was submitted as one we perhaps didn't need to cover So I'll pause there to see if there's any concern with striking that recommendation from our list. Okay, not hearing any, I'll consider that crossed out. Let me make that note for myself. And then also just want to ask if there are others, as you were reviewing the recommendations ahead of our meeting, if there are others that we should strike through at this point. Okay, well then we will jump into our recommendation specific discussion. Let me get our recommendation rubric up on the screen here. And so the first recommendation that we'll be spending some time discussing here is on the screen. It reads as follows: endorse and focus on the issue of high behavioral health acuity releases from KDOC, and any other jail entity. Primary issues include integration of services from incarcerated status to community, focus on high acuity need individuals who may be difficult to house with sexual offenders and offenders with poor impulse control, offenders who have been screened for civil commitment and alternatives commitments and substance use treatment upon release. I believe this is a recommendation from the Governor's Behavioral Health Services Planning Council. So to launch discussion on this recommendation, I would ask the group, is this recommendation an important part of what it would take to have a modernized behavioral health system in our state?
This is Andrea Clark with KDADS. And I would like to pose the question to the group around one, splitting, possibly thinking about splitting DOC and jail releases in terms of recommendations or in terms of looking at potential modernization efforts. I think the resources and the situation that local communities face can be very different than what is available at DOC. And it might be helpful to look at it as two different recommendations instead of lumping in together as one. And then also potentially framing this recommendation in terms of focusing on basically on a spectrum of need and putting, you know, our most resources in with Kansans that have the highest level of need, and that kind of being the framework for this. Offer that for thought.
Yeah, any discussion from the group on that?
Karli, this is Sandra Berg with United. I agree with part of what you're saying, Andrea. I still think the end result is going to be the challenges we face in the state, finding appropriate placement, and even with resources available, from our perspective as a managed care organization, we struggle a lot with this population, whether they're coming out of DOC or out of a jail release. So that's just something to consider. Is the end result is, do we have the resources in the state to provide that transition for them?
Great, thank you, Sandra. Other comments? If not, it sounds like there is interest in this recommendation, and it would just be deciding whether to consider it as one or two different recommendations. Let's start the conversation thinking of it as perhaps one, and if that makes it hard to score, we'll see what we can do about splitting it out. So would direct the group to our ease of implementation column first, looking at some of the considerations listed in terms of the type of change this would require, from program change to a brand new program, cost, etc. What considerations would affect the ease with which an implementation like this could be implemented.
This is Spence Cohen, and I guess for me, before I would answer this, just because I'm not sure, I was wondering if anybody could speak to how the system currently works generally. I know it's going to differ district by district or county by county or DOC, but how are behavioral health services working in the jails currently?
Well, this is Sandra Dixon at DECA. I can speak to a couple of things. I can't speak statewide. I think the most challenging piece of this recommendation is folks who are being released, needing substance use treatment or other supportive services, who are also identified as sexual offenders. There are very few locations in the state that will serve as someone identified as a sexual offender in residential treatment, for example. So I think that's a significant challenge and a specialty that is not available statewide. There are other services, for example, here in Douglas County, we have a project with the local jail to initiate addiction treatment services while they're still incarcerated, medication-assisted treatment while they're still incarcerated, and then when they're released, move them to community-based services, continuing with us. And there are pockets of those initiatives around the state. But there are several offenders who are released statewide, particularly in our Wichita area, who don't have access to the same level of service. We have another project with the city of Wichita to take people out of the county jail, but there's not consistency about that. And many of the things that make it challenging for folks coming out of jail may not be just treatment, but it's access to safe supportive housing, transportation, a job. So those things that all impact recidivism and recovery.
I would add that in Sedgwick County, my understanding, both where DOC is concerned and also for certain the Sedgwick County Jail, that planning and referrals and collaborative process, especially with ComCare, happens for individuals leaving the jail, for instance. To what extent that is able to go forward with an adequate toolbox of resources, I'm not sure. I think that's still an open question.
Spence, does that address your question?
This is Spence Cohen. I think so. So just in looking at the EASA implementation, so would I be fair in saying that it wouldn't be a new program simply because there are some programs, but it might be new to some areas. So, and maybe I'm just from what I've heard, that kind of sounds like there are programs available, but not everywhere.
If I could add, this is Elizabeth Bishop. The new part of it, and it's one that we're working toward over time, is that it's a collaborative process, that it looks at housing, it looks at substance abuse or substance use disorders and the need for treatment. It looks at how many times an individual has been jailed, for instance. How can we address that recidivism? The fact that it's collaborative and trying to get away from these folks over here just deal with veterans, these folks over here just deal with housing, you get the picture. That's what we're working our way gradually toward in this area. And I think also in a number of other areas, and that, as I understand it, is one of the values of the CCBHCs, is that they are supposed to also function across the board in the entire panoply of needs that an individual might have.
Okay, so the note that I've made here is that this might be new programming in some areas of our state. How do we think about cost in terms of the extent to which it would be a barrier to implementing a recommendation like this? So will cost be a barrier to implementation? Or Andrea, maybe
Karli,
going back to, oh, go ahead.
Sorry, this is Sandra Berg with United. I think you're going to take into consideration housing costs and specialty areas that will accept the different types of offenders that have been mentioned. And then I think it's going to take more service coordination to pull all the entities together. Right now, there's some going on, but it's not statewide. So I think those are cost considerations.
And this is Andrea Clark with KDADS. And just from my experience with this is coming from my perspective, experience with the Justice Involved Youth and Adult Subcommittee, is that I think the framework that they were really trying to get with this recommendation is that Kansas is really about screening, that our efforts, that our system should be built around efforts to focus on our highest needs individuals. Not that, so the idea isn't that we're looking at a program to provide these services, but this is a recommendation more around how do we set up our system to identify who has, as the recommendation states, high behavioral health acuity needs. And so when thinking about, from my perspective, when thinking about cost or what are we implementing with this recommendation, it's, this isn't really about implementing specific programs, but how do we identify folks in the justice system with high behavioral health needs? And that the subcommittee's recommendation is really that, we focus on those at the top end of the spectrum, if that's helpful in looking at this.
Mm-hmm.
This is Sandra with United. Andrea, thanks for clarifying that, because the way it reads is it makes it sound like it's more programmatic. So maybe we need to add the verbiage about focusing on assessment, if that's what the recommendation is.
This is Andrea with KDADS, and I think that would really help clarify the recommendation. Would be looking a little bit at the way it's worded, and our ability to really look at what does implementing this look like, because it's a little on the vague side as written.
Sure. So I've made that initial change. This is Karli with KCHI. I made that initial change I heard from Sandra to edit the recommendation to clarify that this would be endorsed and focus on assessment of high behavioral health acuity releases from KDOC and other jail entities. Are there additional clarifying edits that we should make to this recommendation to make sure that it is clear what the recommendation is that the group would be putting forward?
So Karli, this is Denise Zisman from Community Care, and thank you very much, Andrea, for that clarification. That also was very helpful. But given this clarification, I'd like to ask you, based on your initial thought of splitting KDOC from the other jail entities, would that still be something that would be helpful to do in this recommendation?
Well, this is Andrea Clark with KDADS, and I think part of what would make why I suggested splitting it and why I think that might be a helpful framework is splitting DOC and jails is because DOC does have a screening framework that they use through the LSIR, where they can identify, where the highest risks are and what the highest needs are. The ability for local communities and jails to do that is very different across the state, which I'm sure both Chris and Sandra can speak to in our more urban communities. You know, the Legislative Post Audit put out a report a couple of years ago about services available, mental health services available in jails, and screening and assessment is pretty low on the list when you look at other communities across the state. So I think that was kind of my reasoning behind suggesting splitting the two.
Great, those are really helpful clarifying comments there, Andrea. So was starting to make some edits as you were talking there, and I'm sure there's corrections to be made. Would like to start, if possible, with the KDOC side of it, because I heard you say that there already is a screening process there. So I guess my first question is, what should the KDOC side of this recommendation look like?
Well, this is Spence Cohen. So with the KDOC side, would it make sense just to review what their current assessment system is, and if that still works with best practices, or you know, what makes sense, looking at the whole purpose is transformation. If their system of assessment needs to be reevaluated or come up to different standards.
Thoughts from the group on that? Change the KDOC side to be about reviewing that practice? Okay. And I would direct the group to kind of the other half, where we're thinking about those released from jails. What changes do we need to make to that side of the recommendation?
This is Elizabeth Bishop again, and while not exactly answering the question that you asked, Karli, one of the factors is that there are certain individuals in the community who rack up a lot of jail stays and end up costing the county and the system tens of thousands of dollars. I don't want to quote you a figure because I probably don't exactly remember it, but it's astronomical for one individual, for instance. So looking at the fact that it's trying to break the cycle of going into jail, receiving, I think, fairly decent mental health care in the jail, because I know that the sheriff, for instance, puts a new psychiatric nurse into every budget cycle somehow. And then coming out and becoming homeless, you know, lapsing into substance use, abuse, and starting the whole cycle over again is one of the reasons that a really thorough collaborative handoff is absolutely necessary. And I think that's exactly what was the earlier person was referring to in Topeka, Shawnee County.
Great, thank you. So in the interest of time, I'm going to move us forward towards scoring. So I'm going to ask that we score the jail side of this recommendation. So looking at this bottom recommendation here, what considerations related to ease of implementation does the group think is applicable? So we've said it would be new to some areas of the state. Will cost be a barrier? Does this does the recommendation include strategies for continuity?
And Karli, this is Kyle, and I'm been struggling and my brain's getting twisted. This is almost 4 or 5 recommendations in one. Every time there's a semicolon, I see something different and it takes me in a different direction. Absolutely, cost and workforce would potentially be barriers. The examples I give, just simply relating to the way that this recommendation changed by focusing on assessments versus treatment, that lowered the fiscal note on it by millions of dollars. There's only a handful of treatment providers left in the state, as far as I know, a couple of CMHCs, but then mostly private folks that do the sex offender treatment and those that do sex offender and SUD treatment, I've got to think are extraordinarily rare. But even going back to what Andrea said about the LPA, I'm not sure we wouldn't benefit from a very, a 15, 20-minute brief on that LPA, because I know I think maybe every CMHC that serves adults participated in that, and a large number of the sheriffs. And there was an awful lot. I mean, even in Northwest Kansas, where there's 20 counties with one CMHC, some of their problems aren't related to mental health access on the community level. It's the newness of there being a moratorium at Larned State Hospital. And so even the way that that's articulated, them saying, hey, we can't get anyone into the state hospital, that sounds an awful lot like it's related to the mental health center or the community assessment side. But then the reality ends up being that because they've reduced the number of beds as a result of the pandemic, then there's no beds available. And that's nothing that the Western Kansas side, the biggest barrier used to be transportation, or among the biggest barriers. So the ease of, this is one of those things I think that's easier discussed than implemented, but I would be happy to be more optimistic if others want to correct me.
This is Andrea Clark with KDADS again, and building off a little bit of what Kyle said, is that given the way it is currently written, regardless of what I speculate the subcommittee was going for, the way that this recommendation is currently written, it's a whole bunch of different recommendations kind of piled into one. And I don't know that those recommendations aren't necessary, or those topics aren't necessarily being addressed under other recommendations. So, apologies for having spent a significant amount of time on this already, but I don't know if it's not worth it to strike this as a standalone recommendation. Not that the issues brought up by this isn't a priority. I just don't know that that as this is written, it's the best way to address it.
And I would add to that, this is Kyle again, and I agree with what Andrea is saying. And I think that even some of this is probably being discussed in the Criminal Justice Reform Commission right now. So it would be helpful to see if there's some discussion that they've already had that wouldn't result in us reinventing the wheel and taking it in front of the full committee for a long conversation that we realize is already outdated.
Okay, so this is Karli at KHI. What I'm hearing from the group then is that we're gonna strike this one. I'm gonna pause to see if there's any major concern with doing so. Not hearing any. I'll move us on to our next recommendation then. So the next recommendation is on your screen here, is around suspension of Medicaid. It's about ensuring quick, re-access of Medicaid services post discharge from a state institution. We'll remind the group a recommendation that you all made or discussed making last time had to do with ensuring the RFP that was issued to the state hospitals includes a component that allows automated reinstitution of Medicaid eligibility. So would remind the group of that and then pose the question, is this recommendation an important part of what it would take to have a modernized system? And I guess like part 2 of that question is, or is the group comfortable with how you addressed it in your last meeting?
Elizabeth Bishop again. I think that once again, this is one that is already covered. However, it appears there are at least some additional systems out there that are attempting to do the same thing. And I think that the hospitalization one and the folks coming out of incarceration one need to talk with one another to make sure that they're not duplicating, or that nothing is slipping through that is not included. We need some collaboration is what I'm getting at. And I think there may be another track. And it appears that we may also be able to address this issue through the use of waivers. So we're using, as Kyle likes to say, several methods for skinning this cat.
So a question there, was the suggestion to clarify that this recommendation in regard to this topic would be specific to those coming out of a corrections institution? Is the group interested to change the recommendation in that way?
Kyle, this is Brenda Landwehr. Kyle, I thought we already had this implemented.
Yeah, I'm kind of feeling a little deja vu-ish about this. It would be great to just ask KDHE where this stands, or if I don't believe the sheriff from Pawnee County is on our call, but he would probably know this off the top of his head, whether this is working or not. But either we check with the Sheriff's Association or KDHE to see how this is working, because it has been a priority, but I haven't heard it complained about recently. But if others are aware on the call, then I would defer to them.
Well, and Brenda Landwehr again, I think, if there is a glitch in the system, it would be the delay, the time it takes for someone to come off of the Medicaid system and then go back onto the Medicaid system. And if I recall correctly, which doesn't always happen, is you can be looking at 60 or 90 days before that switch occurs.
So, Madam Chair, I think that you're right. And again, this is Kessler, but it seems like it may even be a clearinghouse issue. But KDHE, I think, could probably move this up on the priority list for their contractor. That might be the next step of this.
Yeah. And if I could jump in, this is Jenna Moyer in the Revisor Statutes Office. During discussions last year in regards to the Medicaid expansion bill that was introduced in the Senate, we had conversations with DOC that they did have a policy and a practice that they implement now to get people back on Medicaid who are eligible for it, and that they were currently attempting for local sheriff's departments who wanted help getting their people released from jail. If they wanted help with applying for Medicaid for those individuals, that they would assist them.
And this is Andrea Clark with KDADS. So KDHE does have the contract with APRIS, which is the victim notification system used by both the Sheriff's Association or jails and corrections to notify. They have a system that's implemented and in place to notify KDHE when a person is released and eligible for reinstatement. I don't wonder if the nuance in this question is on the difference between suspension and termination of benefits. The way the system is currently set up is the benefits are terminated and they're reinstated upon release. And it's not the automatic notification system that they have set up. It is a significantly quicker process than just wholesale reapplying for benefits. And I haven't heard specifically of any implementation issues yet on how well that's going.
Yeah, Karli, I think where we're at on Representative Landwehr is, it sounds like we need to get some specifics from KDHE so that we understand exactly what we have in place and how it's implemented. And I bet that we're going to find that gap is the turnaround that it takes. And I don't know that that's all the clearinghouse. I think that's just some of the nuances of the Medicaid system.
Great, thank you.
This is Elizabeth Bishop, and there is a new program that was instituted a year ago within KDH&E utilizing APRIS. It is, as far as I know, focused on those being released from the criminal justice system. And it's working very well, as I understand it. Reinstatement takes place within just a matter of days, 2 or 3 days. And at this time, approximately 83% of sheriffs and jails and so forth have signed up to be part of the overall network that this is operating. The only question that I've got, and this came up when we were talking about data systems and sharing and so forth, is whether or not this APRIS system is focused on the criminal justice system, but missing those who are being released from hospitals. And that was what I was asking last time, that those folks talk with one another to make sure we have a cohesive system.
And this is Karli. I'll jump in here. We'll direct the group back to your crosswalk document, just flagging that there was an agency update provided related to this topic. So that provides some information, but in the interest of time, I think I'll flag that we have some additional follow-up questions here and move the group on to our next recommendation, if that is acceptable. Okay. The next one is again similar. So I'll pause for a second to see if there's something different about how this one's from the Governor's Substance Use Disorder Task Force. So if there's something different about the framing here, we can stay here and discuss, but if not, I would say the same rules apply, and we're going to get more information and decide which, if either of these is still appropriate to maintain as a recommendation.
Karli, this is Kessler. I would suggest that we put this in the same category as the last one and combine them.
Great. Okay. Then our subsequent recommendation here is from the Governor's Substance Use Disorder Task Force, having to do with correctional employees. We'll give the group a minute to read what is on the screen here, but then would pose the question, is this recommendation an important part of what it would take to have a modernized behavioral health system?
Elizabeth Bishop here. Does this include the personnel in the jails in the county, referring back to the audit that was conducted, which, by the way, I requested, that there were some needs expressed by personnel in jails for additional training. And there was a discussion, as I recall, of the difficulty of doing that across the state, and the fact that remote training via computer, in other words, just like telehealth, could be used for jail personnel, both for training and possibly consultation.
So I'll ask the group, is that an edit we're interested to make to this recommendation to clarify that we would want to include employees of jails in this recommendation as well? We'll pose that question to the group.
This is Andrea Clark with KDADS, and we have current existing contract to provide mental health training services to members of the law enforcement community that includes those that work in correctional facilities. And I believe KLETC, through some KDADS funding, also has the ability to provide that training. So I don't know if this recommendation isn't, I guess maybe I'm skipping a step here, but it would, any recommendation on this would be an expansion of those available services, or maybe ease of getting those services into our more smaller communities.
So would expanding these services make this recommendation part of what it would take to have a modernized behavioral health system, or is this recommendation one that has been implemented and the group should strike?
It would be great to know if what action was taken on this. And sorry, this is Kyle Kessler. I think Andrea's right. Andrea, are you referring to the mental health first aid strategies or something different?
This is Andrea Clark with KDADS, and we have training that we contract with Mental Health America, the Heartland, specifically for mental health and law enforcement that is separate from mental health first aid. And then we also have a contract with the Kansas Law Enforcement Training Center to provide CIT training, and they have also developed some online courses that I don't have a lot of information on, but that are around mental health.
So, and thanks,
so this
Andrea.
is separate from mental health first aid.
Okay, well, that answers my question. So Sandra, Sandra Dixon, were you on the SUD task force?
This is Sandra Dixon at DECA. No, I was not. And my question of clarification for you, Andrea, is does that contracted training include training related to substance use disorders?
That's what I was going to ask.
That would, this is Andrea Clark with KDADS, and I think additional training on substance use disorders would be an expansion of the training material.
This is Sandra with United. Would that also, the expansion of training services also include trauma-informed trainings?
This is Andrea Clark, and there is no reason it couldn't if recommended, but I don't believe there is a trauma-informed focus in the current. Well, I want to separate out there is an 8-hour training that KDADS contracts with that's for mental health. It's called Mental Health and Law Enforcement, and it's open to any justice and person or working in the justice system across the state. And it's mostly focused on mental health. I don't believe it's a real high level training for those communities that maybe can't send an officer to a full 40-hour CIT training. So it doesn't necessarily have a deep dive into, trauma, and it could certainly probably expand on SUD more.
This is Spence Cohen with the OJA, and this would be another question for Andrea. Does that include supervision entities, or is it only sheriffs, jails, DOC employees?
This is Andrea Clark, and they would be welcome to sign up for to take the class as well. I would say that the more that is shared across we don't have those restrictions on it currently, but the more that it's shared across, I think, all of these different groups, we would certainly need to advocate for additional resources to put it on. I mean, it is limited. But the limitations are financial, not like that it's a curriculum only for these entities.
Okay, so the recommendation, I think I heard several minor changes to this recommendation in that discussion there. So I want to reflect that back to make sure we have it, make sure we're looking at it correctly. So I've changed the language on our screen to be about expanding these trainings that are offered. The language related to substance use disorders was already in there, but also added the recommendation for the training to include a trauma-informed approach to, I guess, the identification of other mental health needs. Wasn't quite sure exactly how to piece that in. Was there something else that I missed as far as changes that we were making to this recommendation? And with this, with these revisions, is this recommendation part of what we would need to have in place to have a modernized behavioral health system?
I think this is Kessler. I think it helps. And I would even start to say, I would consider a program change that would probably be in the 8 or 9 range, because I don't know that it would be extremely costly. And even to make sure that it includes SUD training and being a trauma-informed SUD and mental health training combination. It seems like something that KDADs could work with their sister agency at KDOC on, that would help modernize our system and make sure that people who are being released could be connected to services very quickly.
And this is Sandra Dixon at DECA. I would concur with that, Kyle. I think offering regular and consistent training to folks who are working in judicial situations will lay the groundwork for the why we might be creating innovation in our system to add services behind the walls in addition to the community. So I think this is a really good recommendation that doesn't cost a lot of money.
So as people were talking there, I've entered the score of 8. I heard an 8 or a 9. I typed 8. If there's concern there, let me know. Any other boxes that I should check under our ease of implementation category? Likely agency budget development there and potentially grant cycles for those providing the trainings. I'm seeing nodding. Okay, then would direct us over to the potential for high impact. What considerations should we list here for this recommendation, and would be happy to entertain a score here as well.
This is Kessler. I would say a 9. Will it benefit a large population? Yes. And in terms of special populations, I think frontier, rural, and urban, and there may be another 1 or 2 on there, but being able to connect people with treatment upon release reduces recidivism. So, and we know that constantly now we're hearing, and I would defer to the chief if he's still on, but the number of people engaged with law enforcement with behavioral health issues is cited as being higher and higher all the time.
Made some of those notes here. Any additional comments on this recommendation from anyone on the working group? Okay, well, in the interest of time, I might take us to our kind of discussion on new recommendations. As a reminder, similarly to our last meeting on data systems, you'll get a Qualtrics survey from me where you can kind of click through hopefully pretty quickly and submit some information as far as scoring on some of these recommendations. So that will be how we will plan to address some of the remaining recommendations here. Apologies for the quick scroll there. But would direct the group to the list of barriers that you now see on the screen. These were brainstormed by this group in previous meetings. And I did kind of copy forward the note that we heard from, I think, Sarah, as she was introducing herself. So the task here is what new recommendations is the group interested to put forward that kind of aren't addressed in the recommendations brought forward from other groups. Ideally, these recommendations, as we draft them here, would address some of the barriers that the group has identified. So happy to start wherever. There's a recommendation that comes to mind looking at this list of barriers. Please go ahead and toss that out.
Elizabeth Bishop here. The one that jumps out at me, of course, is the housing supports issue with an area that struggles with homelessness. That I have heard that repeatedly from folks working within the system in this area. I assume that other especially urban areas struggle with it as well.
Okay, looking at that barrier, housing supports or lack of housing supports, what recommendation is the group interested to make related to that issue?
I don't know how that is addressed from this, this is Representative Landwehr, that it's addressed from the state perspective as much as it's probably something that has to be addressed on the local level.
I'll also flag for the group, there are other places where housing as an issue is addressed, specifically under system transformation for this group, which would be your next meeting, as well as under funding and accessibility, but that's more sober housing. So if I'm not hearing a recommendation here as to how we would address this, are there other barriers that the group is interested to discuss?
This is Spence Cohen. So looking at the drug courts, and I know that I'm also on the Criminal Justice Reform Commission, that there will likely be, and Sarah can actually speak a little bit more to this as she's helped craft some of this, but there will be it's very likely anyway, that the Criminal Justice Reform Commission will be passing on an expansion of specialty courts overall, not specifically drug, but it would be mental health courts and drug courts. So that might get addressed also through that commission.
So Spence, what you're saying is that basically they'd kind of combine those?
Sarah can speak more to that because I know she was very integral in that, but it's specifically just to specialty courts, and I'll let Sarah maybe speak a little more.
Yeah, Spence is talking about some anticipated legislation that a subcommittee of the CJRC has already approved, and it's going to go to the full Criminal Justice Reform Commission. And it would essentially establish a committee that would look at funding for specialty courts and make a couple other changes related to a couple other legal changes related to people coming out of specialty courts in terms of expungement and sentencing. And so, yeah, I think that hopefully will be addressed to some degree by the Criminal Justice Reform Commission. I don't know if having the support of the mental health task force separately will help bolster that, or if you guys want to just leave it to the CJRC.
Representative Landwehr here. I think that, if it was my decision to make today, and it's not, it's all of ours, is because when I look at mental health and I look at drug, those, in my opinion, those should never be separated because they go hand in hand. So I kind of like the fact that they're looking at that. I don't know that we need to reinvent a wheel that's already being worked on out there, but I think that we could give strong encouragement, as you said, Sarah, for them to report back to us to see what it is that they're doing and what we may be able to enhance on that.
And one other thing that just came to mind that the Criminal Justice Reform Commission may be taking up is what the legislators will probably recognize that we call enhanced diversion, where they're looking at trying to get Senate Bill 123 treatment for diversion eligible individuals. And so that may be another piece of legislation that's coming through separate and apart from our specialty courts bill.
This is Andrea Clark with KDADS, and I also work on the mental health and substance abuse working group or subcommittee of the Criminal Justice Reform Commission, and looking at Senate Bill 123 expansion of that for diversion as well is on our list of potential recommendations. So I think there's potentially several opportunities to look at diversion related treatment, whether that's prosecutor-led diversion or police-assisted recovery initiatives.
How is this is Karli with KHI. How is the group interested to handle this issue for this working group? Is the group interested to put forward a recommendation supporting the work of the CJRC, referencing that the special committee to the work of that group? Would rely on working group members for input as to how you'd like to proceed on this issue.
This is Kessler. I would agree with that.
Yeah, I think we let them handle it and let them report back to, whether it's this group or whatever, because I think we're going to see an ongoing group structured for coming up this next legislative session to keep this discussion going, because we're not, this committee's not going to be able to resolve it all at once. So I'm not sure that we need to engage on this when we've got another committee that's doing it. We just need to know what it is that they're doing, what their recommendations are, et cetera.
And if I could add in one thing, the Kansas Sentencing Commission also introduced a bill on this, I believe in 2019, and it's on their proposed list of legislation that they may support this year. So that could be another group to add in. I don't know which one will be taking the lead on it, the CJRC or the Sentencing Commission, but they both have proposals.
Great, thank you, Jenna.
So it sounds like we probably need to have legislative research looking at, see if there's anything that the committee members here may have missed that's being looked at out there, so that we're not double timing and we can take their recommendations so that we focus on things that are not being discussed on other committees.
Great, so we will get more information on the work of those other groups, but I've made the note that the group is generally supportive of the work, but doesn't want to be duplicative here. So with that, I direct the group to any other barriers that the group had previously brainstormed, any other new recommendations that the group should consider here.
Karli, I guess I'm sorry, Representative Lamware, I'm not sure that I understand the non-restorable children interacting with the juvenile justice system. What does that tell us?
Yeah, any working group members interested to speak to the issue identified here? I think I know, but would hate to speak out of turn. So working group members, anyone interested to address? Representative Landwehr, it's my interpretation that this barrier has to do with potentially some of the crossover youth population, children for whom it's not appropriate or they can't be restored to their home of origin, and the way in which those children interact with the juvenile justice system. What I'm not clear on is how this barrier that the group had previously brainstormed would be different from some of the recommendations that came out of the crossover youth working group. So if working group members want additional discussion on this item, additional clarity would be helpful.
I just don't understand the statement, I guess.
There's not additional clarity that working group members can provide. I would propose that we strike it from our list.
Karli, this is Andrea Clark with KDADS. And can I ask for some clarification too? Are we under this topic of or heading of barriers? Are we discussing potential barriers to a modern mental health system, or are we looking for recommendations of a system? Like, I guess I'm a little unclear as to what these statements are representing, if they're recommendations or barriers, because those are.
Yes. So this is Karli at KHI. Let me provide some additional clarification here. So in the, I think, first meeting of this working group, when we went topic by topic through the issues that the special committee had assigned to this group, the group spent some time brainstorming barriers that should be considered or should be addressed in the recommendations from the group. So I pulled those barriers forward here. So these were barriers that were previously brainstormed by this group that at the time the group felt should be addressed in order to have a modernized behavioral health system in our state. What we're doing now in revisiting them is seeing if there are any recommendations that the group is interested to consider that would address some of these barriers.
This is Andrea Clark with KDADS, and I guess for some of these, I would need more detail as to what the barriers are referring to really be able to come up with recommendations. Like, again, also with the first bullet point, need to look at legal framework and state constitution related to state hospitals. What is the? I would need more context and what that is referring to be able to address as a recommendation.
Mm-hmm. So again, on that one, this is Karli at KCHI, would ask working group members, because again, these came from you all. So if anyone's interested to provide additional clarity on kind of potential changes to the state constitution as it relates to state hospitals here, I think we could get closer to thinking about a recommendation there.
Yeah, I wonder, Karli, Representative Landwehr here, is if we need to, when we have these come up, like, this here, is if behind the scenes, if you guys could track, who was the primary individual that brought this up. And then that way, if they're not in attendance on a meeting, then we'd be able to go back to them to get clarification, because I'm kind of with where Andrea's at. I'm struggling with exactly what it is that we have before us.
Yeah, and I think we have some of that in notes. And Kyle, hate to put you on the spot, but looking at this first barrier here, I'm thinking, I'm going by memory, I would need to pull our notes back up to say for sure. I'm thinking this first barrier here potentially came from you in a comment. So I'm wondering if you're interested to provide any additional context on what this barrier is.
Yes, your memory's good, Karli. And this is Kyle Kessler. And my conversation about this has been rather enduring for probably some people, but even potentially under that, putting and knowing that this was going to be the work group that would discuss, again, the law enforcement or legal system engagement or interaction with mental health or behavioral health. I think that the Care and Treatment Act in Chapter 59 is another part of that. And so as we look at modernization, because Article 7, Section 1 is the portion that says that the state shall foster and support facilities for persons with mental illness and intellectual and developmental disabilities. So that's the part that I think that we've been violating for the better part of 5 years. I don't think that anybody ever intended for the moratorium at Osawatomie State Hospital to last months, let alone years. So I think that this is part of that conversation. Now, coming up with a recommendation, it really is to review it and probably Jenna or someone from the revisor's office giving an opinion on that part of the Constitution and how it relates to the community mental health system would make a lot of sense in not just this committee, but probably criminal justice reform and others going forward, because that's just a conversation, at least on any of the task forces or committees or councils or commissions that I've been on. We've never gone back to talk about what it is that, when I got a call from somebody else engaged in this committee this morning, and they said, what are we trying to reform? I mean, if we have a good blueprint for a system and the partnerships at the community level can work well if we have enough beds, or, depending on the, how things are working with the judicial branch or other pieces, then we should just be looking at funding and enhancing versus reforming. So I didn't get into the parts of the conversation parsing each word, but I understood the point that he was trying to make. So that is a pretty long explanation for where I'd like that conversation or barrier to go. But I think that KSA 59 is part of that as well.
And this is Andrea Clark with KDADS, and I think a slightly deeper dive on that topic in regards to the criminal justice system and the state hospitals would be potentially looking at, in terms of modernization, potentially looking at the competency restoration process, and how that affects local communities, local jails. I believe as well, in practice, competency restoration in Kansas only happens at Larned. And a potential recommendation could be looking at modernizing how that process happens.
Okay, this is Karli at KCHI. I think I heard a couple things from the group there. Let me make sure I've made notes so that we can follow up appropriately. So first, I heard interest in more information on this topic, potentially from the revisor's office. Secondly, a specific portion of this issue that I think I still heard requests for more information was the competency restoration process and understanding what the statute looks like around this so that the group could have a better informed conversation about what modernization looks like.
This is Elizabeth Bishop again. I believe that in Sedgwick County, there has been a contract and agreement worked out where competency evaluations, at least, I haven't heard of the restoration side of that, are conducted here in Sedgwick County rather than having to take a van to Larned. I don't know that they don't still take some individuals to Larned, but I know that has been worked out so that is provided here locally.
And Kylie, this is Jenna in the Revisor Statutes Office. And I just want to clarify that if the committee does want to request information on either of those topics, we would be happy to put together something. And we can't obviously do a legal opinion that states what would happen or would not happen if a court were to take something up, but we can prepare something and maybe do a little brief or a memo to the committee before their next meeting or at the time of the next subcommittee meeting.
Great, thank you, Jenna. And Jenna, before we move on from this topic, do you have the information that you need in order to get that information together, or would additional clarification before we move forward be helpful?
So I think I have the basics in regards to the information about the Constitution. I can look up some case law, just see if there's been any developments about that, and the competency restoration process. That might not all be in statutes, but I can reach out if I have further questions to get sort of a clarifying, clarifying thoughts. But if the committee has anything else other than what's written down that they want specific information about, I just encourage you to just talk about that now.
Great, thank you. Okay. Kyle, go ahead.
No, I'm just going to say that all sounds good to me. I appreciate that. That'd be very helpful information, I think.
Okay. Want to pause one more time looking at this list of barriers to see if there's other conversation related to these issues that would be productive for the group to have at this point. To run through them quickly, I think on the issue of housing supports, I think we noted that it's discussed elsewhere. On the issue of non-restorable children interacting with the juvenile justice system, did quickly reference notes, and it looked like this comment came from Commissioner Brown at KDAD, so we'll follow up with information as to the specifics of what this barrier was intending to address. The other one, or the last one that I don't think we've talked about specifically, mental health within the court system. I want to see if the group's interested to have any discussion related to that issue, or did we get there with the conversation that we were having around specialty courts?
Representative Landwehr, I think we got there with the specialty courts.
And this is Spence Cohen. I know I did bring this up initially, and I think, and I don't know if this was the specific thing that you wrote down, but the one thing is supervision we often see that there's one cost for the person that's not in the court system and another cost for someone that's in the court system. And I thought that that's often a significant barrier for those individuals if they're justice involved, not being able to afford treatment. So I don't have solutions to that or even a recommendation, but I know that that is an issue.
We'll pose that question to the rest of the group. If there are recommendations around this issue that Spence has raised that the group should consider.
This is Elizabeth Bishop. I have a question about the housing supports and the note discussed elsewhere. Could you amplify that a little bit elsewhere within the modernization process that we're talking about, or just elsewhere?
Yeah. Let me be more precise there. Okay. So it is discussed, the issue of housing and housing supports is, I think, primarily discussed in work group 2, the group addressing policy and treatment. It came up in their initial discussion on prevention and education around the idea of the creation of a housing specialist certification. Also expect it to come up in their upcoming meeting related to treatment and recovery. Expect them to there discuss the KDAD's Housing First Bridge program, as well as the supported housing program that provides affordable housing linked to services for low-income homeless or potentially homeless people with severe mental illness. I think housing comes up at least a couple of other places, but primarily, I would say the working group on policy and treatment is discussing this issue. That's not to say there isn't discussion this group could have if you're interested to do so, but would flag those areas as places where I know pieces of this conversation will take place. Does that address your question, Representative Bishop?
It does. Thank you. I continue to believe that housing support is a baseline need for our mental health system, especially for the high acuity part of it. And I note that CMS has, for the first time, begun to develop waivers that includes housing. I understand the state of Minnesota has acquired the very first waiver that includes housing as part of the Medicaid program. And I have asked for that bill to see what that, or that program to see what that looks like, because just an overview would be better than looking at the actual full bill, because I imagine it's rather long to acquire the ability for that Medicaid waiver.
Well, and I would, Representative Landwehr here, and the one thing to keep in mind is anytime that you expand on your waivers out there, there's a huge fiscal note, because I think we're at about right around 55, 57% that's paid by the feds, and then the rest by the state. So that's why I was thinking, if we looked at more on, what could maybe be done on the local levels. It doesn't mean it's not a big issue, because I agree with you, Representative Bishop, on that. But we just got to be very, very careful. That's a huge, huge fiscal note.
This is Kessler, and to piggyback on what both Representative Bishop and Representative Landwehr are saying, there was legislation or proviso put into, I think, the 2017 budget bill. Could have been 2018. I think it's 2017. Maybe Representative Landwehr, you remember this was when you were chairing Social Service Budget Committee, but it was about housing programs. And so it was adding some services, which Missouri had a really good program, but they were a little bit on the cautious side about sharing too much with us because they didn't want CMS to flag it. But I think that it's also something that really had a lot of benefit without changing the waiver, because certainly Representative Lane was right about what impact that has on the cost neutrality pieces of what we do. But that may be something that KDADS or KDHE have a little bit more information on, but so it'll be interesting to see what the policy and treatment working group has.
Great, thank you for that discussion. Unless there's final comments related to this topic today, I'll maybe transition us to a few administrative updates. Okay. As I previously mentioned, there will be a Qualtrics survey that will go out for the group to weigh in on some of the recommendations that we didn't have time to discuss today. So keep your eye out for that. So previously you received from me a Qualtrics survey on data systems. I'd ask that you complete that by this upcoming, I think the date, upcoming Wednesday, to weigh in there. In that same email was a scheduling doodle poll for the group to find times for our next meetings over the course of November and into early December. So completing that will help us to find a time that is as convenient as possible. And we'll aim to try and get those meetings scheduled by next Wednesday. So if people can complete that scheduling poll by next Wednesday, then we'll go ahead and get those dates on calendars as early as possible so that those times will be held. Related to the topic of legal system and law enforcement, as we've discussed here this morning, I expect at the special committee meeting that will happen on October 30th, similarly to last time, I expect that there will be a report out from this working group, followed by some among the special committee and roundtable members about what it means, what a vision around modernizing the interactions between legal system and behavioral health looks like. So wanted to ensure that we have a productive conversation there. Wanted to know if there were any working group members who are willing to maybe volunteer to be called on as we get to some of that visioning discussion, just to share their perspective about what a modernized interaction between these complex systems look like. So looking for a volunteer there if we have one. If not, we can just wait and see who chimes in day of, or see if I can corral a volunteer via some email follow-up. So with that, again, reminder of next steps is to keep your eye out for our follow-up survey on this topic, the existing survey that you have access to on our former topic of data systems. Completing that as soon as possible is appreciated. We'll overview the results of those surveys at the start of our next meeting to ensure that we have consensus on the responses received there. And again, look for scheduling information from me next Wednesday on our meetings over the course of November and into early December. So if you have not completed those doodle polls, please go ahead and do so. I'm going to pause there to see if the group has any final questions about either the work of the group overall or what we were able to accomplish in our meeting here today. If not, I'd like to thank the supplemental experts who were able to join the call today. Your input's valuable in informing how the group discussed the recommendations we move forward on. So thank you so much, everyone. And we will talk at our next meeting, which is scheduled for, let me pull that up, October, click ahead, October 22nd is the next meeting of this group. So we will adjourn until then. Thank you, everyone.
Thanks, everyone.